Yes, yes, you can straight. उषा जी तेरे पास सातों के नाम है क्या इसमें? एक डॉक्टर है, विदेश डॉक्टर और एक ये डॉक्टर। और दूसरी ब्लैंक है, उसका नाम ब्लैंक है। I request all of them to come and get the product.
उनकी है क्या? हाँ कॉपी कर दी ना? हाँ इसमें मैम एक स्लाइड ब्लैंक है इसमें
शो पे करके देखो।
शो पे करेंगे तो उधर जाएगा।
नहीं नहीं होगा,
उधर जाएगा ना।
देख लेंगे। ठीक है देख लेंगे।
अवॉइड कैसे करना वो बता दें.
Slaughter है?
And he will be here regularly. He will be
Slaughter.
बता दें. Let everybody take the front seat and then you start without a मैसेज करो पीछे. मैसेज करो पीछे स्टेज लाइट ऑन कर. आप देखिए आराम से.
Namaskar, and a very, very good morning to one and all. Respected dignitaries, invited guests, the administrative and academic heads of the university and its constituent colleges, faculty members, and the postgraduate and undergraduate students of our university. It gives me immense pleasure to welcome you all this morning as we assemble here to witness one of the most prestigious orations of the Mahatma Gandhi University of Medical Sciences and Technology, the Dr. Rustom Phiroze Soonawala Oration 2026, being delivered by a renowned consultant urologist from Mumbai, Dr. Phiroze F Soonawala, on a very interesting topic, artificial intelligence in urology. Amongst your huge round of applause, I request the Honorable Chief Guest and today's orator, Dr. Phiroze Soonawala, to kindly take his seat on the dais. Please give a huge round of applause to our Chief Guest. Please join me and continue to applaud as I invite the Honorable Founder and Emeritus Chairperson, Mahatma Gandhi University of Medical Sciences and Technology, Dr. M.L. Swankar, along with the guest of honor, consultant obstetrician and gynecologist from Mumbai, Dr. Phiroze Soonawala, and the chairperson cum chancellor of Mahatma Gandhi University, Dr. Vikas Chandra Swankar. I also request the Vice Chancellor, Mahatma Gandhi University, Dr. Achal Gulati, the Pro Vice Chancellor, Mahatma Gandhi University, Dr. V.K. Kapoor, and the Registrar, Mahatma Gandhi University of Medical Sciences and Technology, Mr. Pradeep Pine, to join the dignitaries on the dais. Ladies and gentlemen, this Dr. Rustom Phiroze Soonawala Oration was initiated more than a decade ago in honor of our beloved founder chairperson, Dr. R.P. Soonawala. He was indeed a legend in the field of obstetrics and gynecology and a key contributor to the advancement of infertility treatment in our country. A great teacher and an extraordinary personality, this institution owes its existence and recognition to the blessings and guidance of late Dr. R.P. Soonawala. In January 2025, at the age of 95, he left us all for heavenly abode. But his legacy and blessings shall always be cherished, and the Mahatma Gandhi University family shall always fondly remember him as our patron and mentor. Indeed, we are his extended family. Today, as we gather here to witness this oration in his honor, I humbly request our chief guest, guests of honor, and all dignitaries seated on the dais to commence this program with the lamp lighting and floral tribute to our beloved late Dr. R.P. Soonawala. I would also request the members of the Soonawala family seated off the dais, Mrs. Roshni Soonawala, Mrs. Arnaz Phiroze Soonawala, Dr. Rohit Sahani, Dr. Nilesh Doctor, and Dr. Bela Nilesh Doctor to kindly join the dignitaries for the lamp lighting and the floral tribute.
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा।
As the dignitaries pay a floral tribute to late Dr. R.P. Soonawala, let us all also bow our heads in deep gratitude and seek blessings of Lord Ganesh and pay our tribute to this legend. Thank you, dignitaries. As we extend a warm and cordial welcome to our chief guest and all guests of honor, it is time now to present them with floral bouquets. And for this, first and foremost, I would request the founder and emeritus chairperson of Mahatma Gandhi University of Medical Sciences and Technology, Dr. M.L. Swarnkar, and Mrs. Meena Swarnkar, the vice chairperson of India Education Trust, to present a floral bouquet and welcome our chief guest and orator for this day, Dr. Phiroze Soonawala, consultant urologist, Sir H.N. Reliance Foundation Hospital and Research Center, Mumbai. Please give a huge round of applause for Dr. Phiroze Soonawala. I would now request the chairperson cum chancellor of our university, Dr. Vikas Chandra Swarnkar, to present a floral bouquet and welcome the guest of honor, eminent obstetrician and gynecologist and son of Dr. R.P. Soonawala, Dr. Phiroze Soonawala. As I mentioned, we have other members from the Soonawala family who have joined us to witness this event. I would request the Director, Hospital Administration, Dr. Shobhit Swarnkar, to present a floral bouquet to Mrs. Roshni Soonawala, seated off the dais. Dr. Shobhit, may I request you, please? Mrs. Roshni, she is daughter-in-law of Dr. R.P. Soonawala. Thank you, ma'am, for joining us. I would now call upon Shri Ram Ratan Soni ji, the CEO and Chief Finance Officer of Mahatma Gandhi University, to present a floral bouquet and welcome Mrs. Arnaz Phiroze Soonawala. I would now request the former Vice Chancellor and Chief Advisor to the Chairperson, Dr. Sudhir Sajdev, to present a floral bouquet and welcome Dr. Rohit B. Sahani, a CTVS surgeon from United States. May I request the Medical Director and Superintendent of Mahatma Gandhi Hospital, Major General Dr. S.S. Jaiswal, to present a floral bouquet and welcome Dr. Nilesh Doctor. Dr. Nilesh is a GI surgeon from Mumbai. And may I request Dr. Rajat Vora, the Additional Principal of Mahatma Gandhi Medical College and Hospital, to present a floral bouquet and welcome Dr. Bela Nilesh, Doctor, who is a pediatrician from Mumbai. I once again extend a warm welcome to all other dignitaries seated off the dais and also those who are watching this event live. May I now request the Chairperson cum Chancellor of our university, Dr. Vikas Chandra Swankar, to deliver the formal welcome address.
Chief guest of today's oration, Dr. Phiroze Soonawala, distinguished consultant urologist and transplant surgeon, Dr. Phiroze Soonawala, gynecologist, eminent gynecologist from Mumbai, Dr. M.L. Swankar, founder and emeritus chairperson of Mahatma Gandhi University, Dr. Achal Gulati, Dr. V.K. Kapoor, Mr. Pradeep Pine, members of the Soonawala family, Mrs. Roshni Phiroze Soonawala, Mrs. Arnaz Phiroze Soonawala, Dr. Rohit Sahani, Dr. Nilesh Doctor, Dr. Bela Nilesh, distinguished faculty members, senior clinicians, dear students, ladies and gentlemen, a very good morning to all of you. It gives me immense pleasure and honor to welcome you to the Dr. R.P. Soonawala Oration 2026 at our university. Today's gathering is not merely an academic event, it's a tribute to a legendary medical professional and a celebration of enduring values that define the nobility of our medical profession. Padma Shri Dr. R.P. Soonawala was a towering personality and institution in himself, a pioneer in the field of obstetrics and gynecology, a visionary teacher, a compassionate clinician. He dedicated his entire life towards advancing women's healthcare and strengthening medical education in India. He was the first chancellor, the founder, chairperson and chancellor of the Mahatma Gandhi University. Dr. R.P. Soonawala was a mentor and father-like figure to our chairperson emeritus, Dr. M.L. Swankar. 1980 के दशक के अंत में जयपुर फर्टिलिटी सेंटर की स्थापना और उद्घाटन से लेकर वर्ष 2000 में महात्मा गांधी मेडिकल कॉलेज की नींव रखे जाने तक डॉक्टर सोनावाला का मार्गदर्शन हमारे लिए बहुत ही महत्वपूर्ण रहा। संस्थान के पहले 16-17 वर्षों में डॉक्टर सोनावाला हर वर्ष 15 अगस्त, 26 जनवरी, हर मुख्य उद्घाटन समारोह एवं हर दीक्षांत समारोह में लगातार उपस्थित रहे। यह कहना अतिशयोक्ति एग्जैजरेशन नहीं होगा। यदि डॉक्टर सोनावाला का मार्गदर्शन और प्रोत्साहन गाइडेंस एंड एनकरेजमेंट ना मिला होता तो शायद यह यूनिवर्सिटी आज इस मुकाम तक नहीं पहुंच पाती। वे डॉक्टर एम एल स्वर्णकार और इस विश्वविद्यालय की उतनी ही चिंता करते थे जितना एक पिता अपने बच्चे की चिंता करता है। हमें पूरा विश्वास है वे जहाँ भी हैं वहाँ से हमें आशीर्वाद दे रहे हैं। डॉक्टर सोनावाला exemplified excellence not just in surgical skill but in ethical conduct, humility and unwavering commitment to patient welfare. His leadership in academic institutions, professional bodies and national health initiatives shaped modern gynecological practice in our country. More importantly, he inspired generations of doctors to see medicine not merely as a profession but as a sacred responsibility. Even today, his name commands respect across the medical fraternity. The principles he lived by, discipline, compassion, lifelong learning, and service, continue to guide our institution and also inspire our young doctors. Serving, healing, learning, the three symbols in our logo of the university were given by Dr. R.P. Soonawala. Having this oration in his memory is Mahatma Gandhi University's humble effort to preserve and propagate his ideals. It is our way of reminding ourselves that while medical science continues to evolve at an unprecedented pace, the core values of humanity, ethics, and dedication must remain ever constant. This occasion becomes profoundly meaningful with the gracious presence of the Soonawala family, whose association with us spans across 2 generations now. We are deeply honored to welcome Dr. Phiroze Soonawala, a renowned gynecologist, son of Padma Shri Dr. R.P. Soonawala, along with his wife, Mrs. Roshni Soonawala. Your presence today connects us directly to the legacy we are commemorating and lends emotional depth to our family's bonds and dignity to this distinguished occasion. The previous Dr. R.P. Soonawala orations were delivered by noteworthy and illustrious personalities in the field of medicine, like Dr. Farooq Udwadia, Lord Robert Winston, Dr. Prafull Desai, Dr. T.E. Udwadia, Dr. Ramakant Panda, Dr. Naresh Trehan, Dr. Sultan Pradhan, and the last oration was delivered by Dr. Vikram Patel. It is therefore most fitting that today's oration is delivered by a distinguished clinician who not only carries forward the Soonawala legacy, but also represents exemplary excellence in medical science. I am privileged to introduce Dr. Phiroze Soonawala, a highly respected consultant urologist and transplant surgeon from Mumbai with over 30 years of specialized clinical experience. Dr. Phiroze Soonawala is widely acclaimed for his expertise in renal transplantation, uro-oncology and endourology, and has played a pivotal role in advancing urological care in our country. His pursuit of excellence led him to acquire advanced international training at the Institute of Urology, London, and the prestigious Great Ormond Street Hospital, reflecting his strong academic grounding and a global perspective. His academic brilliance is evident from multiple gold medals and honors he received during his surgical training, underscoring his commitment to scholarship and precision. Currently serving as a consultant urologist at Sir H.N. Reliance Foundation Hospital and Research Center, Mumbai, Dr. Phiroze Soonawala continues to mentor young clinicians while pushing the boundaries of innovation and patient-centered care. The topic for this year's oration, Artificial Intelligence in Urology, could not be more relevant or forward-looking in the present times. We are living in an era where AI is redefining the landscape of healthcare, from diagnostics to imaging to robotic surgery, predictive analytics, and personalized medicine. In urology, AI has begun to transform early cancer detection, surgical planning, intraoperative tumor cell demarcation, outcome prediction, and decision-making processes. However, with such rapid technological advancement also come new challenges, ethical considerations, data interpretation, clinical responsibility, and the irreplaceable role of human judgment. I am confident that Dr. Soonawala's oration will not only highlight the immense potential of AI, but will also guide us on its judicious and ethical integration into our clinical practice. This oration will undoubtedly enrich our understanding, stimulate academic discussion, and inspire clinicians and students to embrace innovation while remaining grounded in compassion. I would like to utilize this opportunity to present a brief introduction about our institution, the Mahatma Gandhi University. Mahatma Gandhi University of Medical Sciences and Technology is proud to be an exclusive private medical university established by an act of the State of Rajasthan Assembly. Mahatma Gandhi Medical College and Hospital was founded in the year 2000 in the presence of Dr. R.P. Soonawala, and with its consistent pursuit of excellence in education, research and healthcare, it was elevated to the status of a university in the year 2011. We are humbled to share that the university is NAC accredited with A+ grade, and Mahatma Gandhi Medical College and Hospital holds the prestigious JCI Joint Commission International Accreditation, making it country's first academic medical center to achieve this global recognition. Our teaching hospital, Mahatma Gandhi Hospital, is accredited by NABH, and our labs are accredited by NABL. We are the largest private hospital in the state of Rajasthan with close to 1,500 beds, and we stand as a pioneer in advanced healthcare, particularly in the field of organ transplantation. Mahatma Gandhi Hospital has performed the first heart transplant, first liver transplant, first pancreas and cadaveric kidney transplant in the state of Rajasthan in the year 2015. Our renal transplantation team conducts nearly 2 kidney transplants every day, including ABO incompatible transplants and 2-way and 3-way swap transplant. We have also performed 6-way swap transplant at our hospital. To date, the institute has successfully completed around 2,800 kidney transplants so far. The hospital also runs an advanced live-related donor liver transplant program, performing 4 to 5 liver transplants every month with outcomes at par with global standards. The credit for this goes to our digestive sciences team, comprising experts from the hepatopancreatobiliary surgery, hepatology, GI surgery, and medical gastroenterology. To date, more than 150 successful liver transplants have been performed in this program. Shri Ram Cancer and Super Speciality Center, which you just visited this morning, is the state's largest multidisciplinary oncology facility with nearly 400 dedicated oncology beds and advanced technologies like robotic surgery and cyberknife. To strengthen early detection and outreach, the university has introduced a mobile cancer screening van equipped with mammography, X-ray, and dental chair and facilities for detection of cervical cancer, and has signed an MOU with the government of Rajasthan to deploy such additional vans across the state. Our Department of Clinical Hematology runs a successful bone marrow transplant program, while our IHBT Blood Center is American Association of Blood Banking and NABH accredited, among the most advanced in the state, with facilities for component separation, HLA typing, and flow cytometry. Mahatma Gandhi Medical College and Hospital is recognized by the National Medical Commission and approved by Government of India, offering 250 annual undergraduate admission, almost 235 annual postgraduate admissions, and 64 admissions in super specialty DMMCH programs across a wide range of discipline. The university comprises 8 constituent colleges, including a dental college, a postgraduate nursing college, College of Physiotherapy, Occupational Therapy, Institute of Allied Health Sciences, Institute of Health Informatics, and College of Hospital Management. With its world-class infrastructure and advanced clinical facilities and commitment to academic excellence, the university stands today as one of the most comprehensive and progressive centers for medical education, research, and healthcare in the country. To our students and young doctors present here today, I would like to say, occasions like these are learning moments beyond the textbooks and the lecture theatres. You are witnessing the confluence of legacy, knowledge, and future vision. Let the life of Dr. R.P. Soonawala inspire you to pursue excellence with humility, and let today's oration motivate you to engage with emerging technologies responsibly and creatively. On behalf of Mahatma Gandhi University of Medical Sciences and Technology, I extend my deepest gratitude to the Soonawala family for honoring us with their presence, and to Dr. Phiroze Soonawala for accepting our invitation and sharing his valuable insights with us. May the Dr. R.P. Soonawala Oration continue to serve as a beacon of academic excellence, ethical practice, and lifelong learning for our future generation of medical and clinical students. Thank you all for being a part of this memorable occasion. Jai Hind. Thank you.
Thank you, sir. Our orator and chief guest for today, Dr. Phiroze Soonawala, as already mentioned by our chairperson, is a highly experienced urologist with specialization in reconstructive and minimally invasive urology. Before we invite Dr. Phiroze Soonawala to deliver the oration, I'm sure we would all like to know more about his accomplishments and contributions towards modern medicine. For this, may I request the Vice Chancellor of our university, Dr. Achal Gulati, to introduce him to the audience and also to recite his citation. And as Dr. Achal Gulati introduced Dr. Soonawala before his oration, may I request the Emeritus Chairperson and Chairperson cum Chancellor to escort him to the center of the stage.
A very good morning to all of you. Legends are born rarely in a lifetime. Dr. Rustom Phiroze Soonawala was one such legend, a towering giant in the field of medicine, obstetrics and gynecology, a father figure to all of us, a mentor to the university, and a leader to the world of medicine. Often described as a man with the magical hands by a noted actor, and someone who stated that who was a propagator, who said that, you see, the minute you retire, you stop using your mind and body, you start aging. Dr. Soonawala never aged till the last minute because he was always active and using his mind. Today is a day focused in the memory of Dr. R.P. Soonawala. The occasion, such as today, is a red-letter day for all of us at Mahatma Gandhi University, where we have an academic giants who stand as milestones in their career and who share the experience for advancement of medical science and betterment of patient care. Today, we are deeply honored to have with us the eminent urologist, a distinguished academician and a visionary thinker, Dr. Phiroze F Soonawala, a trained urologist who graduated from the Seth GS Medical College and KEM Hospital, Mumbai, where he completed his master's training in general surgery, and one who is known across the country and the globe for his academic merit, clinical discipline, precision surgery, ethical practice, and a deep commitment to empathetic patient care, and continues to engage with the future directions in the field of urology and renal transplant surgery. Armed with an MCH in urology and a doctorate in the National Board of Examination in Urology, he further underwent advanced training for his fellowship of the Royal College of Surgeons at the Institute of Urology and the Middlesex Hospital in UK, and then consulted as a transplant surgeon known for his extensive experience in advanced urological care and complex renal transplant in London. But the quotation, however far we may travel in pursuit of knowledge and excellence, the call to one's homeland always remains constant, drawing us back with a sense of duty, belonging, and purpose. He returned back to his roots. Way back in 1995, because of his thought that to return to one's homeland after acquiring knowledge abroad is not merely a homecoming, but an act of service, a service where learning is transformed into contribution to the nation. On his return, he began his homeward journey to dedicate his expertise and global experience to the advancement of tertiary and quaternary medical care in the country, shaping his career and that of others across Mumbai's leading institutions, including the Breach Candy, Jaslok, HN Reliance, Saifi, and the Parsi General Hospital, which were marked by excellence in patient care, academic leadership, and innovation. As he walked along the path of professional excellence beyond his clinical achievements, Dr. Phiroze Soonawala consistently demonstrated a keen interest in emerging technologies and their applications in medicine. His scholarly contributions included numerous peer-reviewed publications, invited lectures, and academic leadership roles, which reflect a deep engagement with the evidence-based practice as well as thoughtful exploration. He was awarded the Distinguished P.T. Patel Scholarship, the N.J. Wadia Scholarship, the G.M. Phadke Urological Society Traveling Fellowship, the Parandikar Oration, and the Dara Kapadia Oration in view of his professional outlook and contributions to the field of medicine. In an era where artificial intelligence is redefining diagnostics, decision-making, surgical precision, and outcome analysis, the fields of urology stands at the threshold of transformative change. Few are better suited to guide us through this evolving landscape than Dr. Phiroze, who brings not only the technical knowledge but also the clinical wisdom, ethical sensitivity, and academic rigor to the discourse on artificial intelligence in healthcare. Renal transplantation has remained a defining focus in his professional life. Over the course of his distinguished career, Dr. Soonawala has been instrumental in establishing and strengthening renal transplant programs at many centers across the country and is now leading the program for development of pediatric renal transplantation at the FRCS Children's Hospital. Equally significant is his role as a mentor and educator. Through his teaching, he has encouraged generations of medicos to approach technology not as a replacement of clinical judgment, but as a powerful tool to augment human expertise, compassion, and responsibility. As his contribution to the field of reproductive health, he has personally performed more than 1,000 non-scalpel vasectomy procedures across India and has trained an equal number of doctors in this technique, supplemented with microsurgical reconstruction and surgical management of infertility. The oration he will deliver today, entitled Artificial Intelligence in Urology, promises to be an insightful, thought-provoking, and highly relevant to clinicians, researchers, and students alike. It is certain to illuminate how innovation can responsibly integrate into clinical practice while preserving the core values of the profession. In recognition of his brilliant career devoted to medicine, education, and humanity, his technical expertise and values of integrity and discipline, the lifelong learning as a clinician, academician who has harmoniously united his clinical excellence, academic vigor, social commitment, the Mahatma Gandhi University of Medical Science and Technology records its profound respect and deep appreciation for his contribution and honors Dr. Phiroze F Soonawala with the flagship oration of our university in the memory of the great and revered legendary father figure, Dr. R.P. Soonawala, the Padma Shri Dr. R.P. Soonawala Oration 2026. Thank you, sir.
May I request you, sir, to please come to the podium. Please give a huge round of applause as we look forward to this oration.
Do you need a collar mic? Collar mic, do you need?
No, I don't think so. Good morning, everyone. Dr. Mohan Swarankar, founder and emeritus chairperson of this absolutely mind-blowing institute. Vikas Chandra Swarankar, Dr. Anchal Gulati, all the other dignitaries on the stage and in the audience, colleagues. It's really a great honor and a privilege to be here today to deliver an oration in honor of my uncle, Dr. R.P. Soonawala. I think Vikas has already talked a little about Dr. R.P. Soonawala, and you will all know him as this legendary obstetrician and gynecologist with worldwide fame, this excellent surgeon, pioneer in the field of family planning and so many other laparoscopic procedures, who has surgeries and instruments named after him. But as a family member, we saw a slightly different side of him. We saw a personal side to him that many people don't know exists. This is a picture of him with his 3 brothers, and the 4 of them were probably the closest of friends through their whole lives. They would talk almost on a daily basis, gossip, discuss, crack jokes aimed at others amongst themselves, and generally have a good time, and they were inseparable. He was the last of the brothers to pass away last year, and that's been a huge loss for the family. Also, what you might not be aware of is that the Soonawalas are a huge family. This is many get-togethers with just a few of us. We had many such get-togethers regularly throughout the years. Most of them were organized, helped, coordinated by Dr. Rustom Soonawala. And as you see, he would be the center at all of these, the father figure to the family. He was in many ways the glue that held our family together. Also, what many people may not know is he had the most amazing sense of humor right up till the end. I remember in his last month or so when he was in the ICU, extremely unwell, and Dr. Balsara, who was treating him, had to come and tell him that he was actually scared to talk to Dr. R.P. Soonawala because he had to tell him that he needed a major surgery which he may not survive. So he explained all this to him, and I was there in the room at that time, and Dr. Rustom just looked at him for a minute. Then he started smiling and he burst into this little giggle that he had and said, "If you're not charging me, then I'm agreeing for the surgery." And that brought the whole tension down in the room. He was that kind of person. Coming to today's talk, artificial intelligence in urology. Artificial intelligence, now it's part of our day-to-day lives. We're all using it for our searches, for various things in our lives. Patients use it when they come to us. They've already researched their problems using some AI program. Governments use it, corporations use it, everybody uses it. In September last year, one of these European governments in Albania has actually come up with a non-human artificial intelligence-based Minister for Public Health to try and eliminate corruption. So this is how far AI has come now. But in medicine, AI is not actually new. It's been around for a long time. The earliest AI systems used in medicine go back to the 60s and 70s, like ELISA, Internist, DXplane. CAD is the very early forerunner of what we're using now to read our X-rays, computer-assisted diagnosis. But all of these were very primitive, not trained well. None of them stood the test of time, and they're all extinct now. In urology, over the last 5 or 6 years, AI has entered almost every aspect, but most commonly, it's used in these areas: prostate cancers, renal cancers, stones, infertility, and now more and more, we're using the AI chatbots. An MRI is the commonest test which is used to evaluate a person with a suspected prostate cancer. And it's extremely reliable, but it's prone to human interpretation variations. So one doctor may report it as possibly malignant. The second radiologist will see the same scan and say possibly benign. So this poses a big problem for the surgeon to decide what to do. And for this, AI has a big role. We now have lots of AI-based MRI reading systems which will very reliably diagnose things. They will highlight where the suspicious area is in the prostate. They'll give you a very precise PIRAD score which tells how likely it is to be malignant. They'll give a very precise location of the lesion and the volume of the lesion. It can also allow a targeted fusion biopsy. So you can target that suspicious area on your biopsy very precisely. These are some of the AI systems which are now commercially available. This is not new. All of these systems have been around for a long time. Quantib is one of the oldest, and this is what we're using most commonly, this top one. But there are so many others available worldwide which are using artificial intelligence to interpret MRIs. And in most of the studies, AI reading is on par with human reading, but it's on par with human reading in high volume cancer centers. The problem is that a lot of these MRIs are read in low volume cancer centers where they're reading maybe 1 or 2 MRIs a day or 1 or 2 MRIs a week. And in those centers, the human interpretation tends to be very unreliable and very volatile. So here, AI-based MRIs score. Another big advance that AI has made is in making liquid biopsies possible. The premise of a liquid biopsy is that prostate cancers will shed tumor cells into surrounding liquids. So you will find prostate cancer cells in blood, in semen, or in urine. And if you analyze these fluids, you can pick up these prostate cancer cells and make a histological diagnosis. The concept of a liquid biopsy is not new. It's been around for more than 10 years, but liquid biopsies were never used because there are serious problems with them. You get very, very few cancer cells in these fluids, And all these fluids have lots of other normal cells. So trying to find a cancer cell in blood or in semen is like looking for a needle in a haystack. It's just too time consuming, too this thing, and for a human to interpret that was impossible. Now with the advent of AI, we have liquid biopsy based systems which can rapidly screen these fluids and pick up even these very stray cancer cells. So for the last 2 or 3 years, liquid biopsy is now making a comeback. And if this becomes a reality, it's already becoming a reality, but not widespread, then you no longer will need an invasive needle biopsy. You can just do a blood test or a urine test and diagnose a prostate cancer. The concept is amazing. These are some of the liquid biopsy-based systems commercially available now. What we use for the prostate is a Caris Assure, and it's also usable for other cancers. But you have specific AI-based systems for specific cancers like ovarian cancers, lung cancers, GI, brain. The gold standard of surgery for a prostate cancer is a robotic radical prostatectomy. Extremely efficient, but the big problem with this surgery is the complication of urinary incontinence. And it doesn't happen in a few patients, it happens in up to 5 or 10% of patients. The only way to try and reduce the incidence of this complication, which puts many patients off from having the surgery, is by sparing the nerves which run very close to or actually touching the surface of the prostate. Now, while the surgeon is doing the surgery, the tumor is not visible to him. He only sees the surface of the prostate. And in an effort to spare the nerves, if he strays into the prostatic capsule in an area where the tumor is close, you risk leaving cancer cells behind and compromising the surgical result. So the success of the surgery is always dependent on this judgment of the surgeon, how far to cut. Now, this is where AI is now making a difference. We have AI-based programs which will take the patient's MRI from before the surgery, generate a 3D model of the prostate. That model will show the precise location of the tumor in the prostate, where the nerves are running in relation to the prostate. And this model is projected onto the operating screen at the time of the surgery, so the surgeon knows exactly where to cut. And this reduces the positive margins and allows nerve sparing. Lumps in the kidney or masses in the kidney are commonly seen, and a CT scan is the most common test we use to evaluate those. Majority of these lumps are malignant. So when you see a lump, the chances of it being benign are hardly 1 or 2%. So by default, most of these are treated as cancers. But it's very important to try and diagnose those 1 or 2% which are not cancerous, because then those patients will have an unnecessary biopsy or an unnecessary surgery. For a human to tell between benign lesions and malignant lesions on a CT scan is often not very easy. But you have AI-based programs which will read a CT scan. They will do an individual pixel analysis, and they will come up what they call a benign score. And in most studies, AI algorithms have been fairly reliable at distinguishing benign from malignant kidney tumors on CT scans. Now what you see here is that lump in the kidney, this. And the AI has highlighted it as a benign lesion. This is an oncocytoma in the kidney. So this person would then no longer need a biopsy, no longer need surgery. He would just be kept under observation. Another test we use to diagnose kidney cancers is a urine cytology. Here also AI is proving more and more useful. It's a very tedious and cumbersome test to do for a human because you're looking for individual abnormal cells in the urine which are shed by the cancer. The premise is similar to a liquid biopsy, but it's not, the equipment used is quite different. And also, since the last 3 or 4 years, you can see, right, the earliest systems for using AI in cytology were developed in 2023. And over the last 2 or 3 years, you have these 3 commercially available systems, all of which have made a big difference in cytology. Their accuracy is not actually that much superior to humans, but where they score is in the screening time. they reduce the screening time by almost 90%. So whereas a human would take hours and hours to give that diagnosis, that AI-based system would give it in minutes. The treatment for lesions in the kidney, or the standard treatment, is a robotic partial nephrectomy. That's generally a very straightforward, easy surgery, because most lumps in the kidney tend to be what we call exophytic, or they stick out of the surface of the kidney and they are visible at the time of surgery. Some lumps, about 10% of these lesions, are endophytic, that is within the kidney, so they're not visible from the outside when you're operating. Now, this is the operative view of the kidney, and you can't actually see where the tumor is within the kidney. For the surgeon to then dissect out this tumor, he has to just use his judgment, and that is what we used to do all along. But now you have AI-based systems which will take the preoperative CT scan, generate a very accurate model of the kidney. So here you see the AI-based model of the kidney, which is in white. It will show you the location of the tumor in red. It will show you the renal veins, which are in blue. It will highlight the position of the renal arteries and the arteries in the kidney, which are in green, and the ureter in yellow. So this model is projected onto the operating screen while the surgeon is operating, and you will know exactly where to dissect, how precisely to cut, and you can spare the vessels. So these are all ways in which artificial intelligence is enhancing our present diagnosis and treatment. Even for stones, we all use CT scans to diagnose stones and plan treatment. Now, these human interpretation and even these high-resolution CT scans are extremely accurate in picking up stones. They'll give a very precise diagnosis of the location and number. But if you do an AI-enhanced CT scan, the kind of fine detail which it will give you in showing the exact stone configuration and the calycial anatomy is unbelievable. This is an AI-enhanced CT scan. One of the treatments we use for stones, small stones in the kidney and even in the ureter, is a URS, or a ureterorhinoscopy, where you pass a telescope through the patient's ureter. You can put it up into the ureter here and you can reach the kidney. It's a flexible scope, so it works very well. And through this scope, you pass a laser and you can pulverize the stone. It's a very simple surgery, but it has drawbacks. You're working in a very, very limited space with a very, very fine instrument, and there's constant movement of this tissue because of respiration. So due to the movement, if your laser inadvertently hits the mucosa of the ureter, you will create serious problems like a perforation or a stricture. So these are the risks of the surgery. To try and overcome that, we now have AI-based robotic systems for ureteroscopy, which are being developed and are now, in the last year or so, even commercially available. This is one which is called ILI. It's from a French company, Sterlab. This is the robot hooked up to the patient. The patient is lying on the table. This is the surgeon operating with that little joystick. He has a little control, watching the surgery on the screen and doing the controlling. And the benefits of introducing AI in this is that you can synchronize the laser pulses with respiration. It eliminates the surgeon's hand tremors. So even in that small space, you get very precise movements. It has navigation assistance and path recording. So even to enter relatively inaccessible renal calyces becomes very easy. These are two other machines which have come out last year for the same purpose. These are robot-based ureteroscopy. Sorry, we've shot these. This is a Chinese company, Zamanix. This is an American robot, Avicenna. Lots of these now coming on the market. AI is becoming more and more used. If you have big stones in the kidney, the standard treatment is a PCNL. It's a very efficient treatment, but for that you have to puncture the kidney and access the stone directly. So the success of the surgery depends on the puncture. That's critical to the success of the surgery, and it's entirely dependent on the judgment of the surgeon. If you puncture the wrong calyx, you will not be able to reach the stone. And even if you puncture the right calyx but at a wrong angle, you will cause severe bleeding. This has always been a drawback of PCNL surgery. So to overcome that, we now have AI-based systems which will allow an X-ray based targeting and allow you to hit the precise calyx. This is an Antec system, the automated needle targeting on X-ray. Is not yet commercially available, but it's developed by a Singapore-based startup and it's expected to launch next year. This is another system, the Monarch system, which does the same thing. It allows an artificial intelligence guided puncture into the kidney. This is being developed by my friend and colleague, Mihir Desai at the University of Southern California in America. It uses the same AI-based X-ray puncture, but in addition, you have a small scope passed up into the kidney. So you can actually see the scope, and along with X-ray guidance, you also have an endoscopic guidance to get this precise puncture. This is the image which you will see in the AI console, and this is the image which you will see endoscopically, and you can see this puncture entering the calyx absolutely spot on. In infertility also, AI is used widely. Semen analysis is the commonest test we use to evaluate a male for infertility. It's usually done by a human, and it gives us three main parameters: the sperm counts, the morphology, and the motility. The counts are fairly reliable, but morphology and motility are very operator dependent. So you will find there's a huge variation in the reports from lab to lab. So to overcome this, we now have AI-based computer-assisted analysis, which are not only more reliable, they reduce the variability, and they're much, much faster. These are three of the common AI-based systems being used. Casanova has been around for a while. A lens hook is a very unique AI-based system. It's actually a small portable device, shoebox sized. And on that, you can load a cassette with the patient's semen sample, and it gives you a report within literally 4 or 5 minutes. A Comet-based assay is also an AI-based assay, but it gives you one parameter which routine semen reports don't give you. That is the DNA integrity of the sperm. Now, this is important in people with severe oligospermia. So this is all where AI is becoming more and more useful. In patients with azoospermia, that is, they don't have any sperm in the semen, the only way they can conceive is by trying to get sperm directly from the testes. So here what the surgeon does is he will take multiple biopsies from the testes of the patient, process those samples and try and find stray sperm in those biopsies, which can then be used to impregnate his wife or his partner. But again, looking for those sperms in these extensive testes biopsies is sometimes like looking for a needle in a haystack. It's very, very difficult, very time consuming. Typically takes anything from 2 to 6 hours. And very often you will miss sperm. To overcome this, we now have AI-based sperm search systems. These are 2 or 3 of them which are commercially available. All of them have been shown to improve sperm detection rates much over what a human could do, and they reduce the searching times by almost 50%. AI chatbots also are now being more and more used in urology. Now, what is a chatbot? Basically, all these AI programs will have a chat service. So you can use it on ChatGPT or Grok or Perplexity, but they give you very, very general answers which are not tailored to specific questions. You have specific AI programs which are fed or trained on only very specific data related to that subject, and you can ask questions related to that subject. So you have AI chatbots which are very specific for prostates and prostate cancers like Prosca, PCS Prep, MedEduChat. You have AI chatbots specific for stones. You have a whole range of AI chatbots very, very specifically for infertility related problems. Some of these are proprietary, which means they are paid. Some of them are very specific to certain institutes, like MedEduChat is only for Mayo Clinic patients. but some are free for patients to use worldwide, like UroGPT is available worldwide. Any patient can log on and use it. Urobot for general urology queries is available worldwide. The big advantage of these chatbots is that they're available 24/7. Any patient can ask a question anytime, so it's very convenient. Plus, they're available even in areas where there is no doctor or healthcare facility available. Even in the remotest of areas, patients can ask about their problems. And most important, they're not judgmental. Many patients will hesitate to approach a doctor for problems they consider embarrassing, erectile problems, infertility, whereas they would be very happy to approach an AI chatbot. The problem with artificial intelligence here, not just in a chatbot, but with general AI for medicine, is that you cannot elicit a history. You depend totally on the history which the patient gives you. And normally, if a patient comes to you, he tells you his problem, and then you ask further searching questions to try and get a better history out of him. An AI program cannot do that. Also, it can't perform a physical examination. It depends on the history the patient gives him and the reports the patient feeds in. So it has very limited inputs, and because of that, it can often go wrong. Also, as we all know, AI programs are prone to what you call hallucinations. This is not an AI program going wrong. This is when an AI program gives you a totally random false answer which has no factual basis at all. Effectively, it makes up an answer. All AI programs are known to do this, though it's getting less and less common. This is of particular importance in India, the use of AI, because like we all know, 70% of our Indian population is in rural areas, and only 25% of our doctors are in rural areas. The WHO has a recommended doctor population ratio of 1 in 1,000. In rural areas, our doctor population ratio is 1 in 12,000. So these rural areas are very, very underserved. An ASHA program, I think some people may be aware of it, is a program established by the government of India. It's been up and running for almost 15 or 20 years. It's an extremely innovative program. It now has almost 10 million ASHA workers. These are basically village personnel, mostly women, sometimes men, who are recruited by the government, trained in healthcare, and they provide basic healthcare, most in maternal health, pregnancy, childcare, public health, in these fields. And this program has a pan-India reach. It's been working very well. In the last 2 years, this program is now getting what we call an AI boost. There's been a WhatsApp-based AI chatbot specifically for ASHA workers, developed by Microsoft, which is now being introduced, and it's getting more and more popular. There are so many other chatbots used which are specific for India. Vaisa is one of these, launched in Bangalore 2 years ago, and in literally 2 years, it's now reached 7 million users. This is another very innovative AI-based program. It's called CureBay. It was launched in Bhubaneswar almost 4 or 5 years ago. It uses artificial intelligence to analyze a patient's symptoms. You feed in your test reports, you feed in the medical images, it will reach an appropriate thing, and then it will be followed by a teleconsultation with a doctor. So it's a hybrid program, but just look at the thing. It costs, for a subscription of little less than 600 rupees a year, you get these free consultations, you get subsidized tests, and you get a 15% discount on medicine. So this kind of program can bring healthcare to areas where there's no healthcare existent now. And over the last few years, they've recruited almost, as you can see, 5.5, 6 lakh patients using this. So more and more used. You've seen all the good side of AI, how great it is, how it helps us, but there are serious problems also with AI. Like I've said, it's not always accurate. It can give wrong answers. One big problem is doctors' over-reliance and de-skilling. When you have an AI program that, say, that radiologist uses to interpret MRIs, and the AI program says this is likely to be malignant, But the human radiologist's gut says it's not malignant. Now, how does he report it then? Most often, he will tend to go with the AI program if he's not sure. And he gets more and more dependent, so you tend to lose your own judgment. And this is a big problem with AI. Another big issue is the data privacy. For an AI system to be useful, it has to be fed huge amounts of data so it can train. And there's no accountability for how this data is kept private. Effectively, it's not. It will be available to anyone. So this is a serious concern. When AI goes wrong or it gives a wrong answer, who is responsible? Is it the doctor who signs off on the report? Is it the hospital that purchases the AI program? Is it the company that's developed the AI program? Who actually takes responsibility for this? It's a big gray area. Also, right now, the big hurdle to introduction of artificial intelligence is the expense. All these systems are extremely costly and not practical for hospitals or smaller centers to implement them. There are also issues with job loss, though that is not so much of a concern with doctors. Most of the jobs which people expect are likely to be lost are more at the back end, related to documentation, billing. It's very unlikely in the near future that AI has the capacity to actually replace a doctor. AI has also had some very, very spectacular failures. And this, I'm not talking of small startups which have failed. Those are like hundreds of them. These are huge flagship programs developed at costs of sometimes 2, 3, 4 billion, not million, dollars by big reputed companies which have fallen flat on their faces. IBM Watson, which was developed for oncology, very famous program. Lots of people in the audience may have heard of it. It was used at Memorial Sloan Kettering, Cleveland Clinic. So it showed great promise, but by 2022-23, it was found to be so error-prone that IBM had to sell this at a loss, and now the program is no longer running. Epic is a program which is used in the majority of hospitals in America, basically for the EMR, that is medical record keeping. And as an add-on to that, they had an Epic sepsis model. So if a patient came to casualty with infection, you didn't know whether you could just send him home with antibiotics or this would likely lead to sepsis and you need to admit him. So they had a software-based program to try and predict that. Showed great promise. It was used in large numbers of hospitals in America, but it was found to be so error-prone, errors in more than 50 or 60% of patients, it was removed in 22. Same with Google AI, developed by Google. This was used at many centers worldwide. Even Aravind Eye Centers were using it to try and screen for diabetic retinopathy. It was found to be so unreliable, but fortunately, they've managed to revive the program. They've corrected the errors, and now this Google AI program is actually up and running again. The others are all defunct. Babylon Health is another big one. It was developed at a cost of £3 million. It was used widely by the NHS to answer patient queries, and from 2018 to 22, it just became more and more popular. But by 22, they realized that it was giving such unreliable and wrong answers that the whole program had to be junked, and now it's been removed from the NHS. And as you all know, last year, OpenAI, that's the mother company of ChatGPT, is facing multiple lawsuits in the US, claiming that ChatGPT gave answers which caused 7 patients to commit suicide. And we are still waiting for the outcome of this case. What do doctors think about AI? This is a big survey which was launched. The results have just come out. It was conducted in America, and the results are quite interesting. Only 42% of physicians felt that AI was not particularly useful in their day-to-day lives, and it's just another factor complicating healthcare. 40% of them felt that AI is overhyped and can't meet its high expectations. And a large majority, 91%, said they would not trust AI in making any clinical decisions unless it was actually created by a doctor or a medical expert. This is interesting. This is another big survey which has come out from the American Medical Association, which shows AI use amongst healthcare workers. And this is probably the biggest the Association of Healthcare Workers in America. This was a little more promising. It said that AI users actually doubled over 1 year from 33 to 68%. But while so many were using AI, very few were using it for clinical purposes or to improve their surgeries or to reach diagnosis. Most of them were using it for things like administration, billing, documentation. So though AI has a great potential, it's still not commonly used for various reasons. But what we're seeing now is just the early days of AI. What's in the future? What are the things which are now being developed? There are two areas which are developing and very, very rapidly. One is autonomous robots, and the second is that field of what you call micro robotics. Right now, we all use robots in our surgery. It's used in almost every field. But these are basically machines completely controlled by a human surgeon. There's no element of autonomy to it. The machine does exactly what you tell it to do. Johns Hopkins is developing a machine or a robot which is similar to our robot, but which can be operated without a human, which means it will use an AI interface to decide what to do and to actually do it. In 2022, they reported the first few steps of a surgery done by a robot. This was a very, very little thing. They reported some suturing. An intestinal anastomosis was done in a pig model. So the human did most of the surgery, and the robot used artificial intelligence to take 6 or 7 anastomotic sutures. But even that was a huge step. But that was all the robot could do autonomously at that time. But look at this. This is 2025, 3 years down the line. From taking a few sutures, that robot is now progressed to doing almost the entire cholecystectomy in a pig model. It's a huge forward. It's still nowhere near where it can do a surgery in a human. But if progress continues at this stage, it's not far off when you will not need a human to operate on most of us. AI is also allowing the development of what we call micro robotics, that is small robots which can do things which humans can't do now. This is a capsule which is currently clinically available. It's commercially available. It's not something in the making. It's called a pillbot. It's made by a company called NDRTX. It works very similar to the capsules which gastrointestinal surgeons use, which you swallow and then gives you a picture of what's happening in the intestine. The ones we presently use are big. The patient swallows it, it travels through his intestine. At the end of the transit, you recover it from his stools, and then you can recover the feed. But often the feed is murky, often the feed doesn't cover the area which you want to see. Now, this capsule is amazing. It's roughly 3 times smaller than the capsule you now have. Second is it transmits live images. So while it's moving down, you know exactly what you're seeing and where it is. And it's navigable. This is a huge difference. It has small jet thrusters. So if you see an area of interest, you can actually navigate to that. If you feel you've passed that area where you found something abnormal, you can ask it to retrace its steps and go back to that. So this is actually amazing. This is not only available, but it's undergoing its final stages of testing, and one of the centers which has been using it is AIG in Hyderabad. This is another microbot which is not commercially available, but is almost reaching commercial availability. It's called an M2, or it's a magneto-surgical microbot made by a Swiss company called ETH. It's about 2 millimeters in size. It's got a tiny thing. It will contain either small biopsy instruments or small chemicals, and it has a magnetic shell. Now, this is too small to power itself, so the way it powers it is by using external magnets. Because it has a ferric shell, you can use an external magnet to navigate it wherever you want it to go. It can be injected into a body system, like you can inject it into the blood, you can inject it into CSF, you can inject it into the eye, and then use the external magnet. You can tell it where you want this to travel. It can travel to that area of interest, then you disintegrate it, and it will release the medicine or that whatever you want it to do at that spot. I'll tell you how it can be possibly used in a while. The problem with this M2 is it has a solid shell. So often, say if you inject it into a blood vessel, even though it can be navigated, it tends to stick at kinks, it tends to stick in corners, and then you can't dislodge it. For that, they're now developing what we call these liquid metal microbots. These are nowhere close to being launched, unlike the others. These are still at a concept stage, but these are unique. A liquid metal microbot would be less than 1 millimeter. It would be generally about 500 microns in size. Just like the others, it could be steerable using external magnets. And it's malleable, so it has a soft shell which can deform, so it can squeeze its way past even small blood vessels, kinks, obstructions. And most important, because it's a liquid shell, you can engineer it to self-disintegrate, so it doesn't need to be retrieved at the end of its job. So in the future, where can you use these microbots? You can send it down into the intestine to actually get bowel biopsies. You can get cultures to areas which are inaccessible with our present endoscopes. You can send them down into the bowel to cauterize GI bleeders. You can remove small polyps. The others, like the liquid metal bots or the M2, the concept is unique. Say if a patient has had an acute infarct and you need to thrombolize him. Just now, the problem with thrombolysis is you have to give him the drug systemically, which has high side effects. Here you can inject this microbot, steer it to the area of the heart where there's a thrombus. It will release the thrombolysin there, so you can give a large dose of thrombolysin to the area of interest without subjecting the patient to any systemic side effects. The same thing can be used in strokes. The same thing can be used to target tumors. You can deliver a swarm of these microbots to a tumor and release chemotherapy. So you will deliver a high dose of chemotherapeutic agents into the tumor without systemic side effects. You can use it for retinal drug delivery, for renal stones. The future is just endless. So in conclusion, artificial intelligence is already used in almost all fields of medicine, but it's still far from reaching its full potential. What we're seeing now is barely the tip of the iceberg. Over the years, it's only going to get better. More important, it's only going to get cheaper, and it's going to start doing things which we now think are impossible. So the next generations of doctors will have to be AI savvy and incorporate this into their practices. Thank you. I put it up? Mm-hmm. Yeah, thanks.
Thank you so much, sir, for delivering this extremely informative and amazing talk on the role of AI, not only in the field of urology, but also all specialities of medicine, allied health sciences, and diagnostics, and for highlighting the importance of incorporating artificial intelligence for better medical outcomes. Wasn't it an absolutely stunning, absolutely amazing talk? Please give a huge round of applause. Thank you so much, sir, for sharing your valuable insights. As a gesture of our gratitude towards you, sir, for delivering this prestigious oration, it is time now to felicitate you, sir. And may I request all the dignitaries to please come in the center of the stage for the felicitations. So may I request first and foremost our Pro Vice Chancellor, Dr. V.K. Kapoor, to present Dr. Phiroze with a floral bouquet. I think I don't even need to request the audience for an applaud for this amazing oration. I request the Vice Chancellor, Dr. Achal Gulati, to felicitate Dr. Phiroze with a shawl. May I request the Chairperson cum Chancellor, Dr. Vikas Chandra Swarnkar, to present Dr. Phiroze with the scroll. And I would request the Emeritus Chairperson, Dr. M.L. Swarnkar, to present Dr. Phiroze with the oration plaque and also the honorarium. And at this moment, may I request all seated in the audience to give a standing ovation for this wonderful, wonderful oration delivered by Dr. Phiroze Soonawala. The applause should be louder, students. Thank you. All can kindly take their seats. And Dr. Phiroze, sir, may I request you to say a few words. Can we have the cordless mic, please?
I have heard about this university for almost the last 10 or 15 years from my uncle, Dr. Rustom Soonawala. He used to keep coming regularly, and every time he got back, he would tell me in Bombay, you have to see this place. It is so unbelievable, the kind of work they're doing, the quality of work they're doing, the pace at which they're developing. And I kept saying, I'll come. But unfortunately, we never got around to coming here. The first time we actually had the good fortune to come and see this was last year, for last year's oration. And we were so impressed by the kind of institute which you have put up. And I must say, today morning we had a brief round of the hospital, and it's only got better, it's only got bigger. The kind of healthcare which is being delivered here, the cost at which it is being delivered is just mind-boggling. And what can I say? It's really been a pleasure, an honor, a privilege to be here again today for today's talk. Thank you.
Thank you, sir. May I request the dignitaries to kindly take their seats. So, ladies and gentlemen, as we all know that amongst the dignitaries on the dais, we also have the eminent obstetrician and gynecologist from Mumbai, proud son of Dr. Rustom Phiroze Soonawala, Dr. Phiroze Soonawala himself. May I request you, sir, to address us all on this occasion.
Today, I do see many more students than we've seen in orations in the past. And importantly, when you see this kind of technology being showcased in front of you, we as medical students in our days always had this luck and opportunity to be able to stay in the front of any upcoming new medical treatment or modality. We've seen the advent of laparoscopic surgeries, we've seen the advent of robotic surgeries, but we were never exposed to any of this in our undergraduate or postgraduate days. What I see in front of me are people like you who have this opportunity to enter into the medical education system when these things are at their infancy and rapidly progressing. And I would tell all of you all, you have to seize this opportunity to stay in front of everybody else. I would really doubt that there are as many centers or universities and medical colleges in India or the world where you have the opportunity to actually see this kind of cutting-edge technology being used in front of you. And it would be a shame if, as students, you all did not take this opportunity to learn everything about all the various new technologies and modalities which are available in front of you. We have had the honor and privilege of being taught at one of the paramount teaching institutes, all of us here who are sitting here as guests and everybody, which was the KEM Hospital and St. J.S. Medical College. And we were lucky that we were exposed to all of these things from a very early moment in our training. And do realize and accept that that has given us a huge opportunity to get where we are. As students, I would advise you, seize this opportunity, don't waste it, because believe me, it is going to take you much further down your career and further down in life. Don't miss this opportunity ever. Thank you.
Thank you so much, sir. After this wonderful oration, we still fondly remember Dr. R.P. Soonawala, and we were fortunate to have seen him live here at several occasions, all thanks to our founder emeritus chairperson, Dr. M.L. Swankar, sir, the proud student and proud mentee of Revered Dr. R.P. Soonawala. May I request you, sir, to address us all on this occasion.
इतने अच्छे वंडरफुल और आई ओपनर ऑरेशन के बाद मैं आज के टॉपिक के बारे में कुछ नहीं बोलूँगा, पर डॉक्टर सोनावाला, आरपी सोनावाला को तो आपने सबने देखा ही है, बट आई हैव बीन लकी, आई एंड माय वाइफ मीना, वी हैव सीन elder brother of Dr. R.P. Soonawala, Dr. F. P. Soonawala, your father, many times in Jaslok Hospital and other places. And he was first to start kidney transplant in the country. So this family, Dr. Soonawala family, amazing family. Trust me. Amount of the knowledge, amount of the depth they have. And with that, humility, how to approach the patient, how to treat the relatives, how to treat the attendants, one has to learn from these legendaries. We are grateful that, or lucky that Dr. R.P. Soonawala, I came into contact of him almost 40 years before, in year 1983, not 2083, 1983. So almost more than 40 years. And since then, our bonding have increasing every day, and now joining of Phiroze as a board of member of management, and every year and every occasions we will have more and more such wonderful orations, and our students, our faculty keep on enriching with their experience. And with these words, I am really grateful to you, Dr. F. P. Soonawala, that such a wonderful lecture we could listen. Thank you very much.
Thank you so much, sir. Like every year, today's oration was again another academic feast for all the faculty members and students seated here. To conclude today's program, may I request the Pro Vice Chancellor of our university, Dr. V.K. Kapoor, to deliver a formal vote of thanks.
Good afternoon. The easiest task for anyone to do is to say thanks, because it doesn't require any artificial intelligence, which I don't have. It requires a very small bit of intelligence, which I presume I have. So I think I'm the suitable choice to propose the vote of thanks today. At the same time, on a serious note, it's a very pleasant duty because it gives you an opportunity to express your gratitude, and therefore it is my pleasure to propose the vote of thanks. If the vote of thanks is following an oration named after a person and a personality of the stature of Dr. Rustom Soonawala, it is an honor. So I'm honored to be given this opportunity. First and foremost, on behalf of the university, the management, the administration, the faculty, staff, and students, I would like to express the thanks to Dr. Phiroze Soonawala for accepting our request and invitation to deliver this prestigious oration of the university. We are also grateful to Dr. Phiroze Rustom Soonawala to be present on the occasion as the guest of the honor. The relationship between a mentor and a mentee is not a one-time or a time-bound relationship. It is a relationship for life. We are grateful to the members of the Soonawala family to be present here, which tells us that the bond between Dr. Swankar and Dr. Soonawala was a bond which will last forever in the family of late Dr. Soonawala and in the family of Dr. Swankar, which is the faculty and students of the university. On a personal and departmental note, I would like to also thank the presence of Dr. Nilesh Doctor, an eminent GI and HPV surgeon from Mumbai, and Dr. Bela. On behalf of the faculty, staff, and students, it is my duty to thank the senior management of the university, Dr. M.L. Swankar, the emeritus chairperson, Dr. Vikas Swankar, the chairperson, Dr. Achal Gulati, the vice chancellor, Shri Ram Ratan Ji Soni, the Chief Executive Officer and Finance Officer, and Dr. Sudhir Sachdev, the Chief Advisor to the Chairperson. On behalf of the university, I would like to thank all the deans and principals, the medical director, director hospital administration, faculty, officers, staff, and students, and all the guests in the audience, specifically the guests from Mumbai, to be present on this occasion. On a personal note, I would also like to thank the organizing committee, which has organized this function. And in fact, all of us should thank ourselves also that we decided to be present here on this occasion, because the masterly and scholarly oration delivered by Dr. Phiroze Soonawala has showed us a new world which has allowed us to know that using the modern technology, we can augment our natural human intelligence, not by mathematical proportions, but by logarithmic proportions. And we as healthcare workers can use this augmented intelligence to help the humanity to serve the patients and not to destroy and damage the world as is being done today. Thank you very much.
Thank you, sir. With this, we come to the end of today's program. I, Dr. Bushra Fiza, extend a warm gratitude and thank you all for being a lovely audience. Thanks to our chief guest and all the dignitaries seated on the dais. And we look forward to more and more such academic events in our university in the future also. May I request you all to kindly rise for the national anthem.
Jana Gana Mana Adhinaya दायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंग तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
All dignitaries, guests, and faculty members are invited for lunch at the Grand Cafe, RK Academic Block of the university. Thank you.